What is gestational diabetes? This video explains what happens to you and your baby if you develop gestational diabetes and which treatment options are available. We begin at the dining table. Most food contains carbohydrates, which the body transforms into small sugar molecules in the intestines. The sugar molecules are used as fuel by the cells. For the cells to absorb the sugar and get the necessary energy, insulin is needed. Insulin is made in the pancreas and acts as a key to unlock the cells, allowing sugar to get in and be used as energy in the body. Pregnancy brings many changes in the body. In some women, the body's cells become less sensitive to insulin. The result is that the cells cannot use the insulin the body makes effectively, and the blood sugar levels therefore get too high. When blood sugar levels are too high, you will be diagnosed with gestational diabetes. Let's have a look at how this affects you and your baby. Blood sugar passes through the placenta to the baby. If you have high blood sugar, your baby will get more nutrition than it needs. The extra sugar results in the baby growing more than normal, and it may become too big. This leads to a higher risk of complications related to the delivery. In addition, your baby may have low blood sugar levels just after birth and has a higher risk of developing jaundice than other babies. After birth, both you and your baby's blood sugar will usually return to normal levels naturally. If you do not get treatment for gestational diabetes, the risk of problems increases. So let's look at what you can do about it. Firstly, you need to be aware that you have gestational diabetes. Most pregnant women will not have symptoms. It is therefore important that you get your blood sugar levels tested during your regular pregnancy checkups. One way to do this is to take a urine sample and check for sugar in the urine. If you are diagnosed with gestational diabetes, the treatment basically consists of keeping your blood sugar at normal, stable levels. You can do this by eating healthy and being physically active. In addition, it's a good idea to measure your blood sugar levels daily to ensure that everything is as it should be. About 20% of women with gestational diabetes will find that, even with a healthy lifestyle, they still have high blood sugar. These women will need to supplement a healthy lifestyle by taking insulin. Gestational diabetes increases the risk that your child may become overweight later in life, and you will both have a greater risk of developing type 2 diabetes. If you have had gestational diabetes, you should, within the first months after giving birth, have a glucose tolerance test done at your doctor's. In addition, you should regularly have checkups at your doctor to look for symptoms of type 2 diabetes in the following years. If you plan on becoming pregnant again, it is important to check that your blood sugar levels are normal. Finally, healthy food and exercise can prevent the development of type 2 diabetes. You can learn much more about gestational diabetes at VidenCenterforDiabetes.dk. Thank you for watching.